It is a disease that affects nearly everyone, with half the UK population likely to be diagnosed at some point in their lifetime. Yet treating cancer is constantly developing, finding better and quicker methods of fighting it, and the Southampton Clinical Trials Unit has just been given some good news in their efforts.
Yeah, well, we've received 3.5 million from Cancer Research UK for core funding to the Southampton Clinical Trials Unit. And what this will enable us to do is to have staff that can work with clinicians and researchers and patients to develop the next generation of cancer clinical trials.
This new funding is part of the Cancer Research UK network and has opened up a new world of possibilities to researchers at this site.
What we'll be able to do is investigate new treatments and produce the evidence for benefit in the hope that future patients in the NHS can receive those new treatments. We're very interested in a certain number of disease areas like lymphoma, esophageal throat cancer, bladder cancer and prostate cancer, and especially with the treatment of immunotherapy. And there's a new generation of drugs which will allow your immune system to identify those cancer cells that have previously been hiding and under the radar of the immune system.
Clinical trials are constantly tested, with new methods coming to fruition each year. One patient to have undergone clinical trial treatment is Sue Endersby, who was first diagnosed with cancer in 2012.
I was gardening one day and I pulled a muscle when I was digging. A lump came up and didn't think anything of it. I just thought, oh, it's a lump. Daughter's bullied me to go and see the doctor. Went along, they checked me over, and then the bombshell came that I had non-Hodgkin's lymphoma.
It was after this diagnosis that Sue was offered the opportunity to take part in a new trial method, and after some deliberation, she agreed to be part of the test treatment.
They said, well, we've got a clinical trial coming up, would you be interested? Gave me a lot of information regarding the trial. So I took the stuff home, had a look at it, read through it all, and thought, well, I can benefit someone else maybe.
Sue has now been cancer-free for 5 years, but knowing she was part of the research that could help save several lives is her biggest reward.
I feel great because it's helped other people, and that is amazing to say that I live in an area that has helped everybody across, not just even Britain, it's across the world as well.
With the new funding being provided, the Clinical Trials Unit hopes they are one step closer to achieving their latest targets.
Our aim, and all us Cancer Research UK researchers work as a network, our aim is by 2034, 3 in every 4 cancer patients survive their cancer.
Linus Harrington, That's TV.